It's time to ask the public whether they would pay a national health tax. The Chancellor of the Exchequer is under attack yet again for not giving more money to the health service in last week's autumn statement. But I think it's time for a more radical approach on health. As a country, we all know we can't meet the ever-growing demand for free healthcare without paying more. And it seems no politician is ever going to ask us all to pay more tax to meet that demand. Instead, they say this.
The NHS will always be free for everyone under a Conservative government.
A Labour plan to rescue our NHS.
Investing an extra £10 billion in the NHS.
We will defend it to the end of our days.
When they should be saying this.
We need to
pay a national health service
tax.
What was that? Do it again.
We need to
pay a national health service
tax.
I think we need to have a referendum, believe it or not, on whether we should introduce a health tax that rises significantly in line with demand. It's a simple question for a simple issue. Let's ask the public, are they willing to pay more for a better health service? If they say yes, fine. If they say no, then at least we know that the majority are not prepared to put their money where their mouth is.
OK, so I use the NHS. I think it's a fabulous institution and I want it to remain. Would I pay more money for it if that's what was required? Yes, I would. However, I would only put money into a system that I knew was as effective and as efficient as it possibly could be. And the problem that I have with the NHS at the moment, I understand it's underfunded. I understand that one of those reasons is because we're living so much longer than we used to. We make bad lifestyle choices, so I understand the challenges. But I still struggle with the amount of waste that goes on in the NHS. So do I want to chuck money into something that will potentially be wasted? No, I don't. I want to see technology being used much, much better in the NHS, which would make cost savings. I want to make sure that the only people that are using the NHS are those people that are absolutely entitled to use it. I want to see things like joined-up procurement and things like that to save money.
But answer the question. If we had a health tax, say it's 5p in the pound of our... or
I will answer your question very clearly.
The question is, when you are asked, would you pay more so that we can have a better health service, you're going to still have all those inefficiencies because something of that size will always be there.
No, my answer to that is, will I give you more money today for the NHS as it is today? No, I won't. Will I request for you to fix the NHS inefficiencies and then I pay more? Absolutely, yes, I will.
But how do you ever know whether it's been fixed? Actually, all the studies suggest that the NHS is actually quite an effective and cheap way of providing healthcare.
Very briefly.
It drives us all nuts at times.
But let me very briefly tell you some things that I would do. So, for example, one of my bestest friends, they think that she may have cancer at the moment. We are going through such a long-winded process for a diagnosis. We went back the other day to get some results. And here's my thing. We had to go into the hospital, we had to sit, we had to wait, we had to have like a 5-minute conversation with this guy where he read some stuff to us. Point number one that I would do is I'd introduce technology. So I would make, like Skype or video consultations. I would do that. I would introduce charges for missed appointments. I would do centralised procurement. I would look at the staffing and the agency costs. So those are the things that are quite simple that I would start with.
I once spent a year wandering around the National Health Service to come up with a report on the patient's charter. And actually, those sorts of things. Missed appointments. Do you know whether these most people miss appointments? They forget about them.
Yeah.
Why? Because they're old and they got the appointment 6 months ago and were told to come there. You could easily do things like that. But that's not the big money.
That's what I was going to say.
That's not the big money. You can do... I agree with you about people coming from overseas just to use the health service. I agree with that. You don't... But that's still not the big money. The truth is, the demand is forever growing, and we as a society have a choice. Do we want to pay
and we're living
more?
longer.
But then or do we not? And what I'm saying is, I think we should define the health service as something separate from the rest of taxation and say there is a tax that pays for the health service. Now, make up your mind. Do you want to pay more, or do you accept that you're not going to get as good a service as you've had?
Surely
in the
the point is that if it's a bottomless pit, that it doesn't matter how much money you put in, it still doesn't do what everybody expects it to do. Then something fundamental has to change, because ultimately, how much money? If this is a one-off tax, and you're saying 5% effectively, 5p
No,
in a pound.
I'm saying,
It would
I
be an
suspect,
annual
well, at the moment
tax,
we
isn't
spend
it?
roughly 5p in every pound. of
Okay,
tax.
how much? I don't know what the figures are, but I don't know how much that would raise. But when
5p would, I think 5p and a bit more on the top rates would pay for what we've got now. Then you say, OK, are we prepared? I'm all for asking the public, are you really prepared to pay more to get a better service?
But then it just plugs the gap, doesn't it, for another... It's another sort of paper over the crack. If the fundamentals are wrong...
So if you
with
want
the
to
NHS,
change the fundamentals, you've got to start again. You've then got to go back to...
But no politician's brave enough to stand up and
that's the
actually
problem.
change it.
No, because the NHS is seen as a religion
Well, no,
in this country.
it's a vote. It's
He's
a
going to
massive vote.
explode in a minute.
Come on, Nick.
Go on, Nick.
We already pay it. It's called national insurance.
No, it's not a...
We are paying for it. And I do like you. I really like you. I am
What's that
thanks for
got to
that.
do with
staggered
anything?
by
not a
how
thing-
out of touch
It's
you
not
are.
a thing that worries me whether I'm like you or not at all.
Good answer.
So I'm not sure I really
am
want you to like me.
staggered by how out of touch you are. And I know for us we can blithely say another 5p in the pound, blah, blah, blah. There are people out there, the just about managings, who are derogatorily referred to as the jams. I hate that. Who are one missed paycheck away from total financial wipeout.
I agree with that.
The car blows up, the boiler goes, the fridge breaks, they won't have a
understand
Christmas.
that.
The idea to ask them to pay more tax, you are so far removed from real people.
Fine, then stop
For the
complaining
NHS?
that the health service isn't good enough.
Michelle is right.
No,
Michelle is right.
Efficiencies would save
I want to
some
stop
of it.
hiring agency nurses. I want to stop paying people, bosses, twice what the Prime Minister earns. It wasn't that long ago that we had more managers than beds. We renew company
Nick,
cars for
this
these
is all
managers.
the old prejudice. In the end,
this is spending £2 billion
fine.
a
So you
week.
think you could save? You think you could save billions?
Yes,
Billions.
on a budget of
By
116, yes.
You've learned this from your radio show, have you?
No, not at all. No, I would
So
get people...
how do you think you know how to do it?
I would get people like Justin King, who used to
Yeah.
run Sainsbury's. I'd get someone like Terry Leahy, who used to run Tesco. They know the value
Sure.
of a pound
So
because
you
they
can-
make a pound.
But you can make it
But
up.
that's a whole different
But what we know is
ballgame.
we've got obesity, we've got an ageing population, but really what we've got is more and more expensive drugs.
Well, I'd make
that
fat
are being
people
developed
pay.
that,
I've said
that
this
are
before.
great for society. But
And
there's
an
a cost
ageing
to them.
society as well.
So let's assume that it is going to cost you more. And what I'm saying is, let's define it. You say it's
Until
national
we
insurance.
They can't
Greg,
afford it,
Nick,
Greg.
No,
until
but
we
that's-
join up lifestyle
Yeah.
and health,
Yes.
until we properly join that up through the provision for
Yeah.
sport at school, for
Healthy
people having
eating.
outdoor spaces
So, yeah,
to play in, until
fat
we
people
join that up,
paying.
I don't think any of this is going to touch us up. We have
again.
to. No,
So-
I mean, I did that on gamification about creating a more positive environment where people get rewarded
But-
for looking after themselves. Now, we as people have to own our health. We have to take responsibility for our health, because if not, the burden is just going to
But everybody
continue
I
to
talk
make
to
the system creak.
who works in the health service or involved
But
with the
his
health
tax
service
could help
basically
educate
say,
people in
look,
that
there
way.
needs to be more money. Now,
Bloody hell,
if there needs to be more
116.
money, how do we pay for it? If we choose as a society we're not going to do it, then we have to do something
I
radically
would
different with the way
happily
the
pay
health
more.
service
Because you can afford it, my love. You can afford it. Other people can't. They are bouncing on the bottom. They are just about managing. They will be watching this if they can afford to watch it with their head in their hands. Please don't make me pay more tax. They can't. It's not. The money's not there.
I'll then put it on the top rate. You can pay it then.
I can pay.
But is that going to make it? Are there enough people
Then
on the
you
top?
pay
I'm going to pay the whole country.
Make a bit, all I'm
Work
saying
even
is,
harder.
can.
no, there's 2 points. There's 2 stages to this. The first of all is you've got to define how much we're spending on the health service
Yeah.
and make it into a health tax, so we all know, because it's not national insurance isn't all of it.
Well, why don't we
National insurance pays for
ring-fence? Why
pensions.
don't we ring-fence something
fine.
that we're
so we
already
have a
paying?
hypothecated
Yeah.
tax and say, of your income tax, of your current income tax, 25% goes to the health service, right? And we'll say, right, that's the health tax. And then
Bang goes the defence budget.
That doesn't cost any more. That doesn't cost any more.
This is going to rumble on and on and on.
It is.
I most certainly think that I'm
Like my
right.
appendix.
Fix the system first, and when it's fixed, if it needs more money, I'll gladly pay.